Have you heard about bipolar disorder and wonder what that is? Bipolar disorder is one of the mood disorders. So mood disorders are disorders of the mood. There's bipolar, there's depression, there is mania. So these are disorders affecting our mood. In bipolar disorder, someone's mood fluctuates between two extremes. So either they get really high or they get really low. The really high part of the mood is called mania. So if someone someone is in a manic phase, then they have elevated mood, they're extremely happy. Sometimes they have racing thoughts, they're over talkative, they might be overspending, they might be engaging in high risk behavior. For instance, they might be doing things like, it's like someone has no inhibitions, like all fear is gone. They feel like they can do anything. They might have an increased level of self-importance. Someone feels like they are really like the best thing that ever happened in the world, or they might feel like the president, or they're even God, or those kind of things. That's what a manic episode is. So this is one of the reasons why you shouldn't just be saying you're bipolar or you feel bipolar, because sometimes it's used in casual conversation, but actually it is a mental illness. And someone who is bipolar, that is type 1, which is the classic case, they will have manic episodes in which they have all this going on. It must happen for at least 1 week, or in case it was so severe that they got hospitalized, it might be even less, like 4 days only. But it has to be a long and sustained period, not just feeling very high in one day and then now you have a manic episode. It has to be a prolonged, sustained, high elevated mood associated with these other symptoms. There is also increased libido, there's easy irritability, reduced need for sleep. So someone can be feeling super productive, they can do so many things, they can do so much and they don't even sleep, and they feel like they don't need it and they're fine. And then also the appetite is low, so there is no need for appetite. So you can imagine what this is like. Someone is moving on, doing a lot of work or whatever it is they are doing, and then it's hard to even think because their thoughts coming very, very fast. So they might be talking very, very fast, and then they have a high libido. They might have a high libido. They're very irritable. They don't need sleep, they don't need to eat, so it's really not sustainable, which is why sometimes even by default you might have gotten hospitalized or admitted, or like people will have to intervene because it's quite clear that you're not okay. As long as you have one manic episode, then you're considered to have bipolar type 1. That's because if your mood has gone so high, then another time it's going to go at least normal. It might not go so low, but even though it goes to what we call a euthymic or normal mood, then those are two extremes still. Like it's considered bipolar because there are two like extremes. And other times people with bipolar disorder might also have depression, especially after the manic episode. You're more likely to crash, and then after that you can end up having a low mood, especially when you start remembering the things that you did when you were manic, because remember you are doing them because you're not yourself. But now when you're remembering it, you can easily have feelings of shame, of guilt, which are understandable but are not also necessary, because it's not your fault. You didn't know what was happening, so you want to be aware of that. If it's something that you suffer from, is to try and remember that it wasn't your fault, and that might be also making your depression worse. Bipolar disorder is treated using medication. We have medication and we also have talking therapy. But if it's severe, a lot of the times you want to first stabilize someone's mood before you can start trying to talk through things, because you can imagine trying to talk to someone when even their thoughts are just going at like 100 miles per hour. So we have different mood stabilizers which would be prescribed by your doctor. We also have medication for the different components. So for instance, sometimes people get super depressed. Then if they're very depressed, then they might have some need to use some antidepressants for that moment, in which it would be closely monitored, because if someone with bipolar disorder is given antidepressants when they're having the depression episode, it can easily trigger the mania instead, because remember the mood easily goes up and down. So it's something that can be really, really well managed. It's one of the more classic mental disorders which have loads of evidence for the different treatment options. And when the mood has been stabilized, this is when you can come in with a talking therapy, because there might be all sorts of negative beliefs, a lot of shame, a lot of guilt, and so you need to talk to someone about this, try and understand your own mind, try and understand what's going on, and then also to give you coping skills. For instance, to be able to figure out when you can feel an episode coming on, you can start to feel the triggers or the signs that maybe you're about to get manic, or even that you're about to get depressed. This is where our talking therapy comes in. If you like this video, give it a thumbs up. If you want to know more about the depression bit of the episode, or if someone has got depression, what does that mean and what does that involve, then in this video here I explained it all.